Do you have high blood pressure? In this video, I'll share the best and worst foods for those with high blood pressure. What foods should you avoid? What are the best habits? What should you do? I'll even share a breathing technique that can help manage high blood pressure. I'll cover everything about high blood pressure, backed by scientific evidence in this video. There are 16 tips. The last 3 are most effective for treating high blood pressure. Pay close attention and watch till the end to fully understand this content. Applying these tips can really help you. If you suffer from this, you'll definitely find this video useful. I won't recommend any medicines or supplements. I'm not a salesman or hired by pharmaceutical companies, as you can see. I always share natural, scientifically proven tips without selling anything. This is very important. I'll just ask you to leave a like since I don't have sponsors. Let's aim for 16,000 likes on this video. This helps the system recognize the video as relevant and share it more widely. It's a way to support me making content and help others too, because they'll be able to see this video as well. All right, tip number 1. Cocoa consumption. Cocoa, with all its properties, can help relax your blood vessels. Its antioxidants offer cardiovascular benefits and may lower high blood pressure. And what's the right cocoa dose? About 30 grams per day. So a small bar of dark chocolate, 70% or more, can help. Why did I say 30 grams? Because scientific studies are based on this amount. Beyond that, you'll get more calories, as cocoa has good fats but is calorie dense. And then you'll just increase calories without increasing cardiovascular benefits or blood pressure reduction. So 30 grams would be the ideal dose. Who doesn't like that? Did you find this tip helpful? I was glad to learn this too. I usually consume 30 grams of cocoa daily. I really enjoy dark chocolate. How about you? How do you consume cocoa? Or don't you? But we'll start now. Let us know in the comments. Cocoa is very common in my region. What about yours? All right, number 2. Avoid foods with sugar. Simple sugar. I'll explain why. I'm not completely against sugar. You can have it occasionally. But if you have high blood pressure, it's crucial to avoid all types of sugar. For instance, refined, demerara, and brown sugar. Why? When you have simple sugar, like putting it on top of a cake, when the body digests simple sugars or carbs, it causes a spike in blood sugar levels. To counter this blood sugar increase, your body ramps up insulin production. This creates an insulin spike. We know insulin also affects the kidneys. What does insulin do to the kidneys? It promotes sodium reabsorption, and with sodium comes water retention. This is a fairly recent discovery. Many people, even doctors, aren't aware of insulin's effect on kidneys. For those with high blood pressure or diabetes, it's crucial to cut out simple sugars when trying to lower your blood pressure. I'm not against all carbs, just simple sugars and refined carbohydrates. Moderation is key for those with high blood pressure, okay? It's mainly about sugar consumption. Cut sugar from your diet. You won't miss it, trust me. It might be tough at first, like with sweetened coffee, but gradually reduce over 4 or 5 weeks, then cut it completely. You won't miss it, and you'll thank me for encouraging this, especially with coffee, all right? That's why this second tip is so important. Third, why eat potassium-rich foods like avocados and dark greens? Potassium in the kidneys helps control blood pressure better and can reduce high blood pressure. These foods are important, and it's a simple change to make. Switch from table salt, sodium chloride, to light salt, potassium chloride. This can help lower your blood pressure. If you have high blood pressure, it's worth trying. A note for those with kidney issues: if your kidneys don't work well, especially moderate to severe cases, or if you're on dialysis, before eating potassium-rich foods or switching to light salt, talk to your doctor first. As kidneys lose function in renal failure, they may not filter well and might have reduced potassium excretion. They may struggle to remove potassium from the body, leading to high levels. It can rise in the blood, causing a condition we call hyperkalemia, which can lead to consequences like increased arrhythmias. For those with healthy kidneys, there's no problem. Your body can handle it and benefit your blood pressure, okay? Only for weak kidneys should you consult a doctor before making any changes. Tip number 4. Sleep at least 6 hours nightly and maintain a routine. You might be thinking, but they always said 8 hours. Ideally, it's 8 hours, but some studies show that 6 hours can be enough to regulate hormone production in your body and achieve proper vascular relaxation, which is good for blood pressure. So if you have high blood pressure, you need a routine. This helps your body understand when to sleep and wake up, regulating the circadian cycle, and also the production of a crucial hormone called cortisol. Some think cortisol's bad, but it's not. It's good. Excess cortisol is the problem. Cortisol regulates blood pressure. Issues with it can cause high blood pressure. It's vital to have a routine and sleep at least 6 hours nightly. How many hours are you sleeping? What's your sleep like? Let me know in the comments below. I can sleep 6 hours, but not more than that. With 2 young kids and hospital work, 8 hours of sleep is impossible for me. All right, let's continue. Tip number 5. Remember I said increased cortisol could cause high blood pressure? Tip 5 is to find the root cause. You need to know why the high pressure is happening. Often we can figure out why you have high blood pressure. It's crucial to know this to fix it. What can lead to high blood pressure? Thyroid issues are common, both hyper and hypothyroidism. These can lead to increased blood pressure. So you might do everything right, but if you have a hormonal issue like thyroid problems, it could cause high blood pressure. Other, less common hormonal changes like increased growth hormone called acromegaly and excessive cortisol production, known as Cushing's syndrome, are rarer conditions, but can also lead to high blood pressure. Many people have these. I'm speaking to millions here. Many will be affected by these rare conditions that are often overlooked. So they should be considered and investigated when signs and symptoms are present. There's one condition that's very common indeed, which is obstructive sleep apnea. What's that? During sleep, you have periods where you stop breathing and your blood oxygen levels drop. This can lead to high blood pressure. Not just high blood pressure, but also increased risk of diabetes and cardiovascular issues. So if you experience nighttime awakenings or feel like you're suffocating, for instance, it might not always feel like you're suffocating, but you could be lacking oxygen. Or if you snore heavily, has anyone told you that? Ask others in your household to check if you snore loudly, as it could be a sign of sleep apnea. It's very common and it's something we can treat. The improvement is remarkable. Patients really get a new lease on life after starting treatment for sleep apnea. For doctors, it's rewarding because we can clearly see the improvement. Pay attention to your sleep and changes that can raise blood pressure, like sleep apnea and hormonal issues. Number 6, breathing. Did you know there's a breathing technique that can help lower your blood pressure? I'll explain how it works and give you an example. It's crucial that you write this down to do it correctly. This technique involves 6 breaths per minute for 10 to 15 minutes. For each breath, inhale for 5 seconds and exhale for 5 seconds. This allows you to do it 6 times per minute. Let me show you how simple it is. That's it, 6 times per minute. It's vital to count. 5 seconds inhaling, 5 seconds exhaling 6 times a minute. This is part of official hypertension treatment protocols. I'm not making this up. This has scientific backing and can work as a complementary treatment. Of course, you shouldn't stop taking any medication just because you're practicing breathing techniques, right? This can assist in your treatment. Number 7, blood pressure checks. If you have high blood pressure, it's crucial to check regularly to monitor your treatment progress or to determine if you have a high blood pressure diagnosis. It's really important that you do this. For those trying to control it, I always suggest taking 3 measurements a week at different times. It's also vital to record the results for your doctor to review. If your pressure is stable and your doctor says it's under control, weekly checks are still important. It costs nothing, causes no harm, and can be incredibly helpful. So, take regular measurements and record the results. By regular measurements, I mean checking your blood pressure outside the doctor's office due to white coat hypertension. Many laugh when I mention this, thinking I'm joking, but it's real. What is it? It's when someone's blood pressure is only high at the doctor's or hospital due to anxiety. Even if you don't feel it, this can affect your blood pressure levels. So it's very important. Take blood pressure readings outside the doctor's office. The opposite also exists, called masked hypertension. What's that? It's when someone has high BP outside the office, but at the doctor's, they're calmer and it's normal. So you might be overtreated if you only have high blood pressure at the doctor's. They might prescribe unnecessary meds or not give needed treatment because when they measure, it's normal due to this second example. Most common is when people have high BP at the doctor's. Is this you? Does this happen to you? Share in the comments. It helps others relate as I see this often in practice. In many cases, when I take measurements, the results are much higher than when people measure at home. A person who only has high blood pressure at the doctor's won't need continuous treatment, as the pressure is normal elsewhere. So it's important that you measure and record your blood pressure. Number 8, oats. You saw that I was going to talk about food, right? Besides cocoa, oats can also help with this. Now you might be wondering, what's the right amount of oats? 25 to 30 grams. That's about 2 tablespoons. Use level spoons, not heaping ones. So 30 grams of oats or 2 tablespoons can help with this. If you follow this channel, when I talk about diabetics, I suggest switching oats for chia or flaxseed because most of oats composition is carbohydrates. For those watching their carbs, it's crucial to make this switch. But if you only have high blood pressure and aren't monitoring blood sugar, oatmeal can be very beneficial for you. Besides improving blood pressure, it also helps control cholesterol. Oatmeal contains a type of soluble fiber with these benefits. So, if you were unsure before, now you know. It can help with blood pressure, but diabetics should be cautious. Stick to 25, 30 grams daily for best results. You'll get the benefits without excess carb intake. Many people overdo it, eating bowls and bowls of oatmeal. This won't increase benefits, but will add lots of carbs and calories to your diet. Number 9, eating beets. Beets can help relax blood vessels. Many studies show beets improve blood pressure levels. Beets contain nitric oxide precursors, a potent vasodilator. Many medications are based on this blood vessel relaxation function, but beets can naturally help you in this process. I love beets. How about you? As you can see, many healthy habits involve tasty, nutritious foods that greatly benefit your health. Number 10, fruits. Some fruits have the potential to lower blood pressure. Did you know there are studies on kiwi? Kiwi can help control blood pressure and it's also delicious. Another beneficial fruit is watermelon. Watermelon contains L-citrulline, which can help relax blood vessels. Pomegranate is another interesting fruit. Do you like pomegranate? I'm not a fan, but it can benefit those with high blood pressure. It may help improve blood pressure levels. So, fruits, don't worry about fructose. Fructose isn't harmful to your body. Only excess fructose is problematic. But it's very hard to consume too much fructose. Eating too much fruit daily can be harmful, as any excess is bad for you. But having 3 servings of fruit a day is beneficial without the excess fructose people worry about. Don't be afraid to eat fruits. Number 11. Limit alcohol consumption. Studies show more than 1 drink daily can raise blood pressure and harm your cardiovascular system. Why limit and not completely exclude? Because 1 drink a day won't harm you if you don't have alcohol-related liver issues. Some studies even suggest it might have cardiovascular benefits. Beyond that, the risks increase significantly. So it's crucial to limit alcohol to 1 drink per day. Number 12. And this one you know? Quit smoking. Here I'm talking about cigars, cigarettes, and even e-cigarettes. Many people think e-cigarettes aren't harmful. That's a big lie. They are harmful and can greatly increase blood pressure and cardiovascular risk. Number 13. Coffee consumption. Studies show drinking up to 4 cups of coffee can decrease cardiovascular risk. That's important to note. What's considered controlled coffee consumption? 300 to 400 milligrams of caffeine. For brewed coffee, that's 200 milliliters per cup. So, 3 cups a day. For espresso, it's 50 milliliters per shot, 3 shots a day. This also provides the caffeine dose I mentioned. Exceeding this can harm your cardiovascular system, increasing arrhythmia risk above 800 milligrams daily. That's more than 8 cups of coffee. It's crucial to mind the dose, but coffee is a potent antioxidant with proven cardiovascular benefits. Did you find this tip helpful? It's really important. I'm a big coffee fan. I drink it daily. I should mention that coffee sensitivity varies.
mainly due to caffeine. Some people notice this. My blood pressure spikes after coffee. If you're very sensitive, it's best to cut it out completely. But if you're like me and don't see a significant pressure increase, it's fine. I really enjoy coffee. Number 14, physical exercise. Remember I said the last 3 tips are most effective? Exercise is key for blood pressure control. Why? It improves body composition, builds muscle, boosts metabolism, and relaxes blood vessels. This can help you too. So it has a double benefit. Now you're thinking, what counts as exercise? Do the physical activity you enjoy most. Walking, running, gym, home workouts. Don't limit yourself. If you're too restrictive, you might not do it at all. I see this in practice. Many patients think only gym workouts count. They believe running or walking outside won't help, which is totally false. It does. It's beneficial. Do you like walking? I really enjoy running too. Just do the exercise you like. Swimming's great too, if that's your thing. Don't overthink it, okay? How long should you exercise for benefits? That's important. At least 30 minutes 5 times a week, or aim for 150 minutes weekly. What does that mean? It can be spread over 3 or more days, so if you're short on time, you can focus your workouts on 3 or 4 days. For example, 50 minutes 3 times a week. Cramming it all into one day isn't healthy. Studies show exercising once weekly intensely may increase cardiovascular risk. So aim for 3 or more days. If you can do more, 250 minutes weekly offers extra benefits. I hit the gym 5 to 6 times a week. Number 15, limit salt and sodium intake. What's the recommended limit? Up to 5 grams of salt and 2 grams of sodium daily. A study found people consume 11 grams of salt on average. That's more than double the recommended amount. And why is this so important? Consuming over twice the recommended salt can greatly increase cardiovascular risk and blood pressure if sustained. Many videos claim salt or sodium isn't harmful, but it's like what I said about cortisol. Up to 5 grams of salt won't harm you, but excess will, which many people do. It's not just added salt, but sodium-rich foods like frozen lasagna, burgers, and instant noodles. These processed foods have high sodium. Be very careful with them. Check labels and try to stay under 2 grams of sodium daily, not just those who add salt. Many patients say, my pressure's still high, but I've cut out salt. Let's discuss. They're eating instant noodles and lots of processed meats, like salami, ham, and turkey breast. Turkey's seen as healthy, but these meats are high in sodium. You need to be careful. Number 16, our final tip, is about weight control. A study showed obese people who lost 10% of body weight saw significant benefits in blood pressure levels. Why? When you're overweight, your body deals with a larger blood volume. This increased blood volume, in medical terms, can lead to high blood pressure. So weight control is crucial. What about lowering high cholesterol? Now you know about high blood pressure. Watch my video on cholesterol. Click here for scientifically backed natural ways to reduce cholesterol. Click here. Take care. See you next time.